Our last panel today is addressing governmental needs and challenges faced by the rural community. And we're really fortunate to have 4 speakers with us today who are all closely involved in addressing those governmental challenges that face rural communities. So I'm going to go ahead and introduce them all now, and then we'll go through them one at a time. So our first speaker is Sara Roberts. And Sara is the Director of Rural Health for the Kansas Department of Health and Environment and the Bureau of Community Health Systems. So prior to joining KDHE, she worked for 5 years at the Nebraska Center for Rural Health Research and the Rupri Center for Rural Health Policy Analysis. Her research work ranged from public health systems to rural health delivery and design. She earned her Bachelor of Science degree from Kansas State University and her Master's in Public Health from the University of Kansas Medical Center. Our second speaker will be Patty Clark. Patty served in both the Graves and Sebelius administration as Community Development and Agricultural Market and Program Director at the Kansas Department of Commerce. She also served as Director of Operations for the Kansas Leadership Center. She now serves as a presidential appointee and is the State Director for the U.S. Department of Agriculture's Rural Development for the state of Kansas. She received her Bachelor of Science degree in Agriculture from Kansas State, but we'll forgive her. Okay. Our third speaker is going to be, let's see, get the right order, Donna Whiteman. Donna is the Assistant Executive Director of Legal Services for the Kansas Association of School Boards. She began her career, appropriately enough, as a 7th grade English and social studies teacher before she went to the Washburn Law School. We'll forgive her for that as well. And she was in private practice in Hutchinson, while also serving as a Kansas House of Representatives member, including as majority leader during the 1991 session. She also worked as the head of social and rehabilitation services during the administration of Governor Joan Finney, and as Assistant Executive Director of Legal Services for KSB. She coordinates the work of 5 attorneys and assists with providing various kinds of services relating to education law in the state. And our final speaker will be Andrew Kovar. He's an attorney at Triplett, Woolf, and Garretson in Wichita, where he specializes in municipal finance, economic development, and related securities and business practice. He has extensive experience representing municipalities and government agencies in connection with the financing of public projects, special assessments, bonds, and the like. So I think we're going to get a variety of different perspectives on both the challenges and hopefully some of the potential solutions confronting small rural communities as they try to maintain essential services and infrastructure. So I'm going to ask each of our speakers to stay as close to 15 minutes max as possible. I've been instructed to shoot them if they exceed 15 minutes. Hopefully that will provide the necessary incentives to keep on schedule. And ideally that will give us time then after all have completed their talks to have a panel discussion in which we can exchange both with each other and in the audience. So without any further ado, I'm going to ask Sara to come on up and start us off. And if you can, Sara, either clip this on or speak into the mic so that it gets picked up by everyone and the recording machine.
Well, good afternoon. It's a pleasure to be here. Enjoy the nice drive from Topeka to Lawrence, so I'd like to spend the Friday away from the office as much as I can. My role in the KDHE is around rural health, and so I wanted to take a little opportunity to help frame when we talk about rural health and healthcare. As many might see it as a little bit of one sector, but it really does become a complex system. You've probably heard many conversations today about the rural economy, the role of sectors in keeping the viability and sustainability of the community, and healthcare becomes one of those. So naturally, the first reason healthcare is important is the quality of life for the residents. We're wanting to look at their welfare, the health, to be able to live the life as they want it to be. But healthcare is really actually also an economic driver that you'll notice. In Kansas, we have $17 billion of local income comes from the healthcare sector. And that results in even more, about a $22.5 billion total sales. It becomes a very large, important factor in the rural areas even more as a job employer. It is the fourth largest aggregated employer sector in the state, and becomes a key conversation when you're talking to the locals about what the healthcare means to them. It becomes also important to think about what it means to the economy. When you think about healthcare, I like to really encourage folks to think about it as more of a multifaceted system. Not one provider is essentially the only one providing the services. It's a continuum of care that begins from the very beginning into personal health and the public health system, and will end into the palliative care and end-of-life conversations. And in between, we have need for emergency care, primary care, the hospitals, but also even rehabilitation and local health or long-term health care. So as you begin to think about how many providers, how many individuals are involved in designing what does the health system look like for each rural community, the complexity is shown just by the numbers. Then as you begin to think about the payers, the consumers that need to be part of it, it becomes a great system conversation, and the system does not look alike in each community. So while the needs of the rural health people are there, and they're very similar, the design looks very different. And that's based on the resources both locally and regionally. So I wanted to offer a couple examples in Kansas to kind of demonstrate how they can vary. As if you're familiar with Midwest and as everywhere else, we know we're predominantly rural. But when you start breaking it down, we have ourselves rural communities, but also frontier communities. And even further, we talk about the regions and the resources they have. So, for example, we took a southwest county, and I just kind of randomly picked one, and my chosen pick was Haskell County, which is in southwest Kansas. It's going to be predominantly a frontier county. We consider it has about 7 people per square mile. It has, it's a key economic driver. It's about, and it has a good portion of elderly population. And as we start thinking about that, it begins a key part to what is the essential services that are needed in that area. Another part of Haskell, though, is key is they have a Hispanic population of 28%, according to some of the data we have. And then they even have a larger farm worker program. And that farm worker program we have in our KDHE sector also works with various languages. And in fact, in that county, there's a very significant low German Mennonite population. So that's a different kind of culture that we have to deal with and think about how do you deliver healthcare services to that community. When you start thinking about the region itself, it's got 1 critical access hospital, which I'll be happy to explain a little later, 3 rural health clinics. And in the structure, there's a long-term care center, there's a local health department that all has some sort of legal formal binding agreement around the hospital, so there's a centralized kind of decision-making process there. Now I'm going to take a kind of a reverse effect and let's go to northeast Kansas, which is still in a rural area, more densely settled, and Potawatomi. They have 2 critical access hospitals. They have additional federally qualified health center near them, but also some primary care, what we call safety net clinics. And their population has a larger elderly population than Haskell, but they don't have the Hispanic population. And then even you add to more of that densely settled rural, their location has them about 40, in some communities, 45 minutes to Manhattan or 45 minutes to Topeka. So then you have another regional aspect you have to understand when you become looking at the health system. So when we think about it from that perspective, it's really important as when I talk with folks and both from the healthcare provider sector, as well as policymakers, to understand the impact a policy may have is going to vary. It's going to vary even in Kansas as well as across the nation of different states because of these resources, the unique characteristics of that community. The needs are there and going to be very similar, but they're going to have a different solution and work differently in different communities. And so as one of the things I wanted to kind of encourage as you in your role and consider that is what are the intended consequences of policies, but also what are the unexpected, what could happen. And that policies created for more of a metropolitan scenario may not necessarily work in rural, but you also have to understand rural policies may not work in frontier or frontier and rural. And this is the same kind of information you've heard and different ideas and different thinking of economic development when we talk about schools and everything else. It just really kind of replicates into healthcare. So I'm sure for the most common public policy or most well-known right now, when we talk about policy affecting healthcare is the Affordable Care Act. But I wanted to highlight some other things that are really important to think about policy that has affected how our system, at least in Kansas, looks from a healthcare standpoint. And it goes back all the way to 1977, when we had the Rural Clinic Service Act created. That was essentially an effort to help address the challenge of workforce, which is continually growing. And by that result, created a payment system that for those clinics that were located in rural areas, considered in the shortage area, they could get a different payment system from Medicare. The result of this, we have 170-ish rural health clinics, it varies every month, that are designated as rural health clinics in the state. And they get that special, different payment. We also have federally qualified health centers. They're different, but they have a different payment. Moving forward, but the most, I think, significant of the policies to think about is what has created the critical access hospital system that we have in Kansas. There are 128 community hospitals. 83 of them are designated as critical access. That designation occurred with the Balanced Budget Act in 1997, and with the effort to address what had become unintended consequences of the new way of paying for healthcare under a fee-for-service model. Like everything else, the fee-for-service model is based on volume, and in rural, volume doesn't work by virtue of its definition. So this model was created as a way to help sustain the hospitals. They recognize that these hospitals need to have certain parameters around them. So in the current scenario of critical access hospitals, you must have no more than 25 beds. You have to provide 24/7 ER coverage. You also have a certain limited time that the patient can be in that hospital, or the physician or provider need to decide, does that person need additional care at a higher level working hospital? As a result of this, we have 83 critical access hospitals, the most of any state, soon to be 84, but we have 83. And it does create a different outlook of our system if you compare it to Texas or Oklahoma. It also has an effect on the policies that we're talking about, because one of the key parts of this critical access hospital model is it's a cost-based reimbursement, meaning there's a formula, a very complex formula that has to be calculated each year, and the hospital has things that goes into it and things that do not. So for example, if your hospital in this rural area of Haskell is providing prenatal care, that doesn't go into the Medicare cost report. That's because Medicare is focused on elderly, and most likely you don't have individuals getting prenatal care at that age. So when you start looking at the complexity of it, then they get a cost-based reimbursement of 101%. In the recent years, there's been a lot of looking at that model at the federal level. There's a little bit over 1,300 critical access hospitals across the United States. It's a very small budget of that Medicare budget, but questions about the regulations, the statutes in place have become increasingly more of a conversation. And as I would forecast, will continue to come as I start thinking about more of the transformation of the healthcare system. So it kind of leads to what is the changing landscape. And I had a couple of ideas and key things I think as you start working your work or interact with others to remember. And one of them, I think, just like everything else, health or information technology is really driving a lot of our changes. In 2009, there was a law act passed that incentivized critical access hospitals providers to adopt electronic health records, and essentially gave them an incentive for a period of time if they would adopt it and use it. And that was based on a lot of literature that says by using health information technology to look and track of patient outcomes, you'll receive a better, higher quality of care. Well, as we're moving into this, we've been implementing the last several years, there's been a lot of impacts to it. One has been for the critical access hospitals, trying to find the resources to invest into could be an expensive system, but also having the resources and staff to work on the system. So a lot of the activities that happen, I know Patty will probably highlight a little bit of them. How do you help the hospital leverage resources to be able to pay for get the capital they need to pay for the equipment, the technology, but then also how do you build a workforce that can do this work and is willing to live in rural communities to do it. Another part of the changed landscape is using telehealth. I recently got to hear of folks in South Dakota about the vast continuum of telehealth services they provide. They provide everything from e-consult to the hospital to doing their pharmacy reviews that's required by Medicare, to everything of being there for e-emergency. So those providers, their doctors, when they're in a scenario they need assistance, they're able to use telemedicine to help them connect to more specialized and to others just to look at a different perspective. But with this increasing use of it, there's additional questions that still have to be answered. How are the payments? How's the payment going to happen? Who's responsible for the decisions made? Is it the physician at the end of providing the hub, or is it the local hospital? How do you deal with information flowing back and forth? Do you need physicians have to have rights? Do you have to have that hub have physician rights in the state that they're practicing that service in? I mean, there are just many complexities that I'll admittedly tell you that this is where I will refer to my own colleagues and connections in the legal world about how do you address these, how do you talk about them. And I don't think I do anticipate more policy happening to kind of clarify those pieces.
Thanks again for helping me get a speaker.
The other thing that really has been moving forward is a change in methodology. We're moving away from fee-for-service to a value and performance model. And we're not quite sure what that value performance model is going to look like in rural. But we do know it's going to involve quality, service, and then overall reducing costs. We have what they call accountable care organizations. I'm sure you've heard, or those who are looking at the health law, probably have seen those in a Medicare shared savings program. But in Kansas, you'll notice there's very few, and a lot of the rural communities, there are very few because it's not yet set up to work as a model yet feasible for those small hospitals. But we're moving towards that thinking. How do you share the risk? How do you share the rewards of having a higher quality of care? That even moves into more changes in policy, because currently, if you're a hospital, you have to report to CMS. And that quality reporting has an impact on your payment. Another example of differences in the critical access hospital, currently that's a voluntary reporting process for critical access hospitals. So from the stance of, because there's many things we're not quite sure about it, but we're moving towards they need to report. The questions come up, how do you deal with small numbers? How do you use that data to inform payment systems? And when you even get further into it, how do you create agreements or relationships that allow you to benefit into the payment bundling shared savings program? Kansas, I think, is one of interesting when I talk to my colleagues across the states, because in Kansas, a predominant number of our hospitals are not a system hospital. If you look at somewhere like Michigan or Wisconsin, there's a lot of international where you have a large hospital that has a satellite critical access hospitals. In Kansas, although we have a lot of them that are county-based hospital districts. That's a different governance structure, a different way of designing, and adds in more complexity to how do you create relationships that go across jurisdictions, which I'm sure works out great as the panel starts talking about it more. So these are just kind of a few things that really are starting to move more conversation, discussion about what the policy is going to look like continue, and will most likely continue over the next 10 years or more, because we're trying to, with the idea of creating a more value-based system will result in reducing cost. But what's the real implications to that? And the frontier, and that's going to be different. So as we start doing policy and we think about it, one of the things that is a core concept that we encourage thinking about is thinking about it as a place-based policy rather than program-based policies. With that concept that every rural community has differences in resources, differences in needs related to the region, and by creating some flexibility, it allows them to strategize in a way that allows them to effectively integrate, effectively look at leveraging what they have available to make the best impact in their community. But as they go through that process, it does take a lot of conversations, and particularly in Kansas, I think that's going to take a conversation that's going to take a broader perspective that involves economic development. It involves looking at even a broader of how does the other systems locally work together? What makes sense when you start looking at your region? What are the services that you need? And those require community engagement, talking with the community members, and involve working with the local government, and it'll involve conversations at the state level as well. And if I had a crystal ball, I would love it and be able to predict what it's going to look like in 10 years, but what I do know is that the important piece will be that there's a sustainable system. We have worked in, the critical access hospital model was created in 1997. We are now in 2014. So there are going to be some changes into that system. The model that we are paying out of is a different model, and it's going to be moving too. And so creating a way that works both for rural and urban will be one of the challenges at a decision level making process we'll have to figure out.
First of all, thank you to the organizers of this symposium. I think it's been fabulous. I have a definite proclivity to embrace anything and everything rural. It's in my blood, it's in my career, and I think talking about it right now in this moment in Kansas is extremely important. That's not an objective statement given my background and my work. But I come to this from the perspective of a career's worth of rural development, delivering programs both at the state and the federal level to our rural communities. And I'm here to make a case that it's time for a change. And I say that knowing that our rural areas are the home to our most precious natural resources. It's home to recreation and national parks and lakes and waterways. It's the vessel of our food production. And as Secretary Vilsack pointed out just this week when I was in D.C., even though 17% of our nation's population reside in rural, what is determined as rural areas, 45% of the young men and women that serve in our armed forces come from rural communities. So it's the people, it's the land, it's the culture, it's the way of life, it's the natural resources, and I believe all of those are extremely important. And also, I think our rural communities, especially in Kansas, are in a watershed decade. And there is very, very little margin for error in the decision-making that they make on a local level. Few demographics, and I'm going to blow through some slides from the Economic Research Service because they kind of go along with what you heard from Dr. Green this morning in terms of what's happening as far as demographics and the economy in rural areas of our nation. But I also want you to remember something else. Some of the conclusions drawn, some of the recommendations made that I'm making and that Dr. Green's making, I'm making from a local level. I'm less than 50 miles from my home. He's greater than 50 miles, but we're in agreement. So I'm in agreement with the resident expert over there. Okay, 44 counties in Kansas reached their peak population, their highest population by or well before 1910. And they've been in a state of decline ever since. Currently, and this is data from the Kansas Association of Counties, currently Kansas has 37 counties with a population of less than 5,000 people. 20 of those counties have less than 3,000 people. Of those 37 counties with less than 5,000, 25 of those 37 counties lost population from 2011 to 2012. And of that, it was 857 people from those 25 counties that lost population. 26 of those 37 counties' tax levies per capita were raised. And that's suggesting a trend that as populations decline, local tax levies per capita are going to rise. I think that's a trend we will continue to see. The rural economy has stagnated. Metro versus non-metro coming out of the period of recession that started in 2008 shows flatline for rural economies. We have not grown. Our economic base has not grown during that time period from 2008 to 2013. Traditionally, rural economies have lagged metro economies, but not to this degree. I want to talk a little bit about natural amenities, but I want to go back for just a second to that other slide. People associate, and incorrectly associate, farm income with the prosperity of rural communities. The last 5 years, farm incomes across America, across rural America, have been higher than they have ever been, ever. Yet, poverty in our rural communities has increased. So just to say that the farm economy is on the rise does not necessarily translate to rural prosperity. Natural amenities is shown based on ERS data. They drive rural long-term population change. If you have natural amenities, the proclivity to have an increase in population is going to be better. If you don't have those amenities, population decline most likely will result. Higher natural amenities have meant greater population growth over the past decade, and growth in high amenity counties has been led by the attraction of talent and entrepreneurship. Amenities include things like Januaries are warmer, Julys are cooler with lower humidity, topography is more varied, land is a mix of forest and open country, and ponds, lakes, or oceans comprise most of the county area. Of which of those does Kansas fall? I would tell you topography. The variation of our topography is something that we might be able to take advantage of. But what that tells me is if we're going to be the place that those talented and entrepreneurial individuals choose to reside, we're going to have some kind of amenity to draw them in. Or we're going to have superior education. Or we are going to have an unbelievably vibrant cultural asset of some kind. Rural county economic types reveal a major difference in economic bases, and essentially this slide reinforces what I just said. And you can see Middle America, it's mostly farming. Not a lot of recreation, limited manufacturing in the southeast part of our state, and other. Rural county mean population change by county type and natural amenities. It's very clear to see from this graph when you dive into it that again, the proclivity of county growth, of rural population growth, does not necessarily come from farming or manufacturing, but rather from asset, such as recreation, culture, etc. Pleasant climate and attractive landscape. We don't rank very high. But I'm here to tell you, I'm not sure that Minnesota does either, or Wisconsin this year. This has been a very brutal winter all the way around. But again, you know, you can look at this slide and you can look at Kansas in terms of where it ranks, and you can say, good grief, what are we going to do? Well, I maintain there are things we can do to make it a great place to live if we make the right investments. Okay. I blew through those slides, but here's what I really, really, really want to focus on in terms of possible considerations, recommendations, solutions as steps. And this is where lawyers and legal counsel will play a huge part. As long as they are informed, as long as they can help make the decision makers make better decisions. Shared services, unified government. And when I gave you my first demographic information, I concentrated on counties of 3,000 or less and 5,000 or less. And this in particular, I think, applies to that. Greeley County is a success story on unification. There's been 2 counties essentially that have undertaken unification of city-county government. Wyandotte County, one of our largest counties, Greeley County, our smallest county. And they did this because and through a very inclusive, citizen-engaged process. And I'm going to talk about the technical aspects and the legal aspects of unification, but I'm going to concentrate more on the social aspects that it took to accomplish this. Greeley County was one of the first public square communities in the state of Kansas. And public square is an inclusive community decision-making process that involves all 4 sectors of the community: business, education, government, human services. It is a citizen-led action team that begins to pursue, it is comprised of citizen-led action teams. That's what public square is. And their unification process started with a citizen-led team as they began to pursue the thought, pursue the conversation of unification, and had to go to the Kansas legislature for permission to study consolidation, to study unification. But it was seeded by its citizens. It was not seeded by government. It was not seeded by a mayor. It was seeded by the citizens of Greeley County. Under our current process in the state of Kansas, in order to unify governments, you have to go to the legislature for permission to do so. And this is what Senate Bill 164 did in the 2006 session. It allowed for the appointment of a commission to study and investigate. It laid out the terms of the study and who would appoint the members of that commission. It authorized, but did not mandate, public forums to discuss the issue prior to drafting a preliminary plan. It established a 1-year timeline for the drafting of that plan. It required at least 2 public hearings regarding the plan, although Greeley County chose to hold many more. It required a dual majority approval of the electors within the city limits and outside the city borders. It required that any proposed change to elected official positions, such as a county clerk or a treasurer, be submitted as a separate ballot issue from the question of unification. It outlined the requirements of any plan for any unified government that may be proposed, and it set up a number of other provisions and specifications. Long story short, Unified Greeley County was officially created January 1 of 2009. It passed with 73% voter approval, most likely because it was a citizen-led process. It had a 60% voter turnout. When have you all had a 60% voter turnout on anything? And it was inclusive and transparent in its communication through its entire process, and I think that's key. I want to point out to you that HB 2185 was introduced last session in our Kansas legislature. And it essentially is enabling legislation, that you no longer have to go ask permission if you want to take on unification, shared services, collaborative types of government. It was holdover from last year. It's being worked this year. It was passed in the 2013 session in the House. It's been re-referred to the Senate Committee on Local Government in January of this year. And essentially it says legislative approval would no longer be required for individual city-county consolidation efforts to go forward. It's permissive legislation. My hope is, frankly, that it passes because it removes barriers to this type of effort. And the case I make is that this is the time for change, and this is the time for communities to look at partnerships, at collaborations, at cooperation, at shared services, at unified government, because as outmigration either even levels off or continues, there's going to be fewer taxpayers to carry the burden of government services, and you're going to have to find ways to work together across jurisdictions to provide what the citizens will continue to demand. And if you don't, then services will slip and people will be left in the void. Future of rural Kansas communities. There are a number of complex issues. Sara just touched on healthcare. That's going to be huge. The provision of healthcare is going to be an enormous undertaking in our rural areas. But water availability is yet another issue. And I'm sure that everybody's heard that the governor has said there is going to be a new 50-year vision for water. But that's being in the planning stages right now. And I would urge each of you to get involved in those discussions and attend those meetings. But I will share with you one thing. Right now, the state has invested, I think it's $200,000, $300,000 to update a study that was done by the Army Corps of Engineers in the 1980s that would propose to build an aqueduct from northeast Kansas, carrying the water from the Missouri River to southwest Kansas, building some type of reservoir to hold the water there, to extend the life of the agro-industrial complex of Garden City, Dodge City, and Liberal. That, and I'm not saying that's a good idea, I'm not saying that's a bad idea. What I am saying is, if that's our answer, we've got a lot more challenges with water availability than we're really admitting to at this point in time. And we better start looking at how we modify the use of our water across the board. And be very serious about it and be very intentional about it, try to create some equitability and some equity in that use of water. To me, when I heard about that, the light bulb just went off in my head and I thought, this is more serious than I even thought it was. And I thought it was pretty serious a long time ago. when I was watching what the overall was doing in terms of its division. We also have water quality concerns in Kansas. In southwest Kansas, USDA Rural Development recently financed a water treatment facility in Lakin to extract uranium from its water. We also did the same thing in Oakland. Both of them were over $6 million. That's not cheap. And the local taxpayers are financing that. These are very complex issues. They take level heads, and they will take innovative, informed, collaborative, intentional leadership for the common good. The polarized discussions that seem to have taken hold will not address these issues in our rural communities. Local units of government are going to pay more for their services. And more of that cost is being driven down to the local level each and every year. Local taxing units need to work together to not overburden local taxpayers. You cannot have a hospital district going to the taxpayers at the same time that a school district is going to the taxpayers at the same time as the city needs to renovate its water system and ask for an increase in taxes because somebody's going to lose in that request. Cooperation, regional strategies, partnerships are imperative, and that is the antithesis of the Kansas culture. The Kansas culture says we can do it on our own. We are very autonomous. We are very independent, and we believe in our own sense of place. So we've got to get past that, but in a very positive way, to make a difference in our rural communities and to make them fit in this new modern economy. One final thought. Do I have time? Okay. The pendulum swinging, and the analogy I want to use in terms of how far we have to come, how far we have to go. And if you can't tell, I'm pretty passionate about this because I so believe in the quality of life in rural communities, and I so believe in their value. World War II generation came from our rural communities, and they're the ones that saved the free world. And that's just one of the reasons that I believe in our rural communities and our rural way of life. This morning, we heard about Buffalo Commons and turning western Kansas into this vast prairie land of grasses to change its economic basis to tourism and visitation and beds and breakfasts and all those things associated that prop up a tourism-based economy. And again, I'm not saying that's right, I'm not saying that's wrong, I'm not saying that's ever going to happen. But what I would like to pose to you to think about is right now, the southwest corner of the state, approximately 8 counties, account for billions of dollars per year in economic activity from agriculture and agricultural processing. So that pendulum, it's over here. And Buffalo Commons is over here. And if Buffalo Commons is decided that, whether it's today or 10 years from now or 20 years from now, they say, well, that's the direction we need to now, that pendulum's got to go a pretty long distance to get there. And it's going to take some very inclusive, very inspired, very innovative, and very collaborative discussions to move that pendulum and not get hung up on very divisive rhetoric. And that analogy of agro-industrial, billions of dollars from the ag economy to the Buffalo Commons, it applies to a lot of other issues that we're dealing with in rural Kansas and rural America. And you all need to be informed. You need to be collaborative. You need to think partnerships and cooperation going forward. And you need to, for those of you that serve as legal counsels in our rural communities now and in the future, you're going to be a voice of reason at the table. You're going to carry a great deal of responsibility, and I believe the KU Law School is preparing you well. So thank you very much.
Good afternoon. I'm Donna Whiteman, and thank you very much for the opportunity to be here today. I want to give a disclaimer. I always say that I have the best job in the state in the sense that I work for 283 school districts. My client is the Board of Education. On a daily basis, I and the other 5 attorneys in our office, we deal with legal issues with superintendents and principals at the building level. I do employment law, student law, but one of the areas of expertise that the practice of law, and it's what's beautiful about the practice of law is that you always get new opportunities. Every day brings a new opportunity, and one of the opportunities I have had over the last 15 years have been working with rural communities as they deal with the demographics of declining enrollment. So I'm going to spend a little time talking about the demographics, and then I'll spend the rest of the time talking about some of the challenges that our rural school districts have. Now, we do have in Kansas school districts as large as 45,000 students all the way down to about 109. But do remember that of all the public schools in Kansas, the median enrollment is going to be about 520 students. So when you think about public education in Kansas, you're talking small rural school districts. That's not to say that some of the large urban districts that I've shown, or will show some demographic information, don't have challenges. But I deal with many of the boards, most of the districts who have consolidated or closed buildings in Kansas. I have worked with the 2 boards to try to bring them together to consolidate into a new district to be able to continue to grow as a community and to provide a quality public education. How many of you in the room graduated from a Kansas public school? Okay, so you probably all have lived some of the demographics that I'm going to talk about. But the demographics are important, not just for education, but some of the demographics I'm going to talk about affect all the entire quality of life, not just public education, not just the education of the students in districts that I work with. But this is not my work. I'm not a demographer. I'm an attorney. I use demographics, just like John Kennedy said, those who don't learn from history are destined to repeat it. What I'm about to show you very quickly is it focuses on what can we do to improve opportunities for those who want to live in rural communities, and particularly the education. Where I'm focused at, our Kansas Constitution requires that the legislature provide through locally elected school boards for the intellectual, scientific, vocational, and educational improvement of all students in Kansas. So the legislature has a big challenge. Local school boards have a big challenge. Remember, local school boards are the only elected officials in the state who serve without any compensation. It is truly the highest form of public service at the local level. I served for 10 years in the Kansas legislature. Most of my constituents in Hutchinson thought I was in Washington, D.C. But a locally elected school board member, they know where they live, they call them, they see them in the coffee shop. So I want to run through just a few things. This is mostly census data, and it's for your research at some other point in time. Public education and the data here is really what this conference is about. What are the opportunities in rural America? What can we do to help keep those opportunities there? Jim, our research director, always wants to tell us about demography, and we all live this one every year. There's a lot of information about the U.S. population trends. There's a lot of information about the Kansas. I mostly focus on Kansas because I work in the Northwest, Southwest, and most of the districts along Highway 36, which I'll talk to you about. I'm just going to show you all of this, not to focus on bad news, but we're always trying to recruit more and more people. Our Kansas census is the smallest percentage of total U.S. now that it has been since statehood, and the trend is getting smaller. Our growth area and strength area are Hispanic families. When you look at the data, our growth comes from our Hispanic population. Important to know that out of 105 counties, 54 have less population today than they did 110 years ago. There are major policy decisions associated with that decline in population. The counties you see here are counties that I work with in helping them to maintain their local schools or to consolidate to provide education to their children. I'm sure you've heard today about some of the history of the Dust Bowl. The population grew, but we had a growth period. We're in a decline right now. And there's a lot of great information here that will focus a lot of our work in the future. Highway 36 and Highway 24. When you look at Kansas County, some of you I see smiling, you may have grown up around those areas. But again, these are originally, when I started working at KSB, we had 304 school districts. We have now 283. Reason for that is declining enrollment. School districts, when their enrollment declines, have only two choices. They close buildings or they reduce staff. And as they slowly decline in enrollment, when they get to less than about 200 students, then that's when they have to look at some of the legal options I presented to you. They can either transfer territory to another school district. They may cooperate with another school district where one school district operates the elementary, the other does the high school. As they continue to get smaller, then they have to look at either transferring their territory to another district or basically consolidating. One of the first districts I helped with consolidation was the Rollins County one because of declining enrollment. The unification, the good news is at one time Kansas had about 8,000 school districts. In 1966, around that time, we had a unification. All of you graduated, if you graduated in Kansas, from a K-12 unified school district. And that was the first step in reducing the number of school districts down to the current, or down to 304, and they've gone lower since then. Depending on what high school you graduated or district, I could tell basically the higher your number, the longer it took your area of the state to get a K-12 system. And the last district was USD 512 in Shawnee Mission, and they had to do it by legislative assistance, as I call it. So a lot of information here about as our folks leave the rural area, if they stay in Kansas, more than likely they're going to one of these larger counties. And this will give you a breakdown that when you put the sales tax, income tax population together, you basically have about 5 counties who combined together equal the same population sales tax revenue as the rural counties. That used to always concern us when I was in the legislature for 10 years because we know that population does drive representation also. And I was from Hutchinson. I was never considered one of the large counties. I was more with the rural counties at the time. And the larger the counties get, there's ramifications for representation in the legislature also. But I'm not going to spend a lot of time on this. Again, the data is there. There are counties again talking about births, residents, first grade. We track births at KSB because we know that 5 years later, hopefully those children will be entering the public schools. And we do enrollment projections because in Kansas, a school district's, the money that a school district has to spend on education is based on one major date, and that's September 20th. How many children are in your district on September 20th? You multiply that by the base state age, which is 38 per pupil right now, and you reach what is the aid that they get from the state. All of your districts, no matter where you were educated, about 70% of the money to educate students at the local level in Kansas comes from the district. So that's why there's always, you've all heard half of the money spent on education. Well, it's one of those duh moments. It's always been half of the money's been spent on education because it's been such a priority in our state. And realtors will tell us this all the time, the most important economic development engine in any state is either K-12 education or post-secondary education. It drives the economy. Education is good for everybody. The question I think we have to face in Kansas is who really wants to live here now? We've all gone through the immigration legislation both at the state and federal level. But we used to advertise for immigrants, and we might be back in that situation again. That's the question. Our growth area and our strength is our Hispanic population in the southwest part of the state and in most communities. And that's the demographic information that we have right there. Our top 10 Kansas counties and Hispanic population are set there for you. I'm not going to really spend a lot more time on the demographics other than to talk now about a few of the challenges that we see with declining enrollment in public schools. The demographics are there. School districts work very closely with local chambers of commerce. And when I go out to work with school districts on consolidation, I always try to tell them, do not look at your just war community. At this time, we can't just think locally, we have to think regionally. And you see parts of the state where they are starting to look not just at their county, but at the entire region. That if an industry comes, even if it's right outside the line of your county, it's going to help your region grow. And that's a major shift, particularly when it comes to public education, because we play our neighbors every Friday night in football, basketball, and cross country, and sometimes we get rivalries that resist change to looking regionally for economic development, job growth, and other opportunities. The major challenge from a school district perspective is we need more families, we need more children, we need more jobs. The families and children, sometimes we can't control that, or government shouldn't really control that. But the one area I think where we can cooperate together are in the jobs area, the growth, the looking regionally. I think that's a challenge that can help, or that's an area that can help. Additionally, even when we get growth, the next challenge is in rural communities, where are they going to live? Housing is always at a premium when we do get new employees or new families. School districts have even started offering, if they have any land, providing it to people who will move in with families in order to help grow their community. So with the challenges of jobs and housing, the other challenge that school districts across the state are facing are financing. Many of you are aware there's a school finance case, the Gannon case, that is currently in the Supreme Court, and every Friday we wait for a decision on what that decision is going to be. That's based on the idea that 70% of your local school district budget does come from the state. So if there are not additional revenues to provide the education services, then it shifts to the local. And most communities across the state have already maxed out on their local option budget when it comes to education. So with that, we'll have a chance, I think, eventually to ask questions that you may have about at least the role of education in rural communities, and we'll pass it on to the next person.
I want to talk a little bit about, we got some great demographics from Donna, but I want to talk about, and this is wholly out of my experience, I don't have any census data to back it up, but kind of where we come from in thinking about governmental needs. The first, the way I kind of think about it is, especially in the rural areas, we have kind of two general populations. And it's an oversimplification. But the first being kind of the adult and aging population. This population is being in your community probably most of their lives. They had their career there, they were farmers, they were shop owners. They've been engaged in the community and they're not going to leave. Even if they probably should, at some point in time, go to a continuing care community or something, they don't want to. And so they're very entrenched in the community. And they have their own specific needs. One big one, of course, we've been talking about is healthcare. They need hospitals, but then they also need assisted living facilities, probably independent living first, and then assisted living, and then moving on to nursing and hospice care facilities. They need housing, just like everybody else does. And that's, in that stage of life, sometimes those two things merge together. The second population that we like to think about then is kind of the family. And youth and families. They're going to be more transient. Some kids may grow up and leave, as we've been talking about quite a bit today. But even the families that move in for some reason, they're just going to be more willing to move out for whether it's lifestyle choices or jobs as they move around. And they're looking for, areas that they want to live in. They want to see commercial activity. They want to see community amenities kind of things. Obviously, they specifically need jobs to stick around. They need to have their own housing in neighborhoods that are suitable for families to live in and be raised in. They need schools, excellent schools, and they need their own different health care, but it all comes together. So, in general, these are the things we talk about as community needs that everybody needs. Everybody needs some kind of industry and jobs. Everybody needs commerce. We need the grocery store and the place to buy clothing. Most places maybe not need, but would really like some tourism, something to draw in economic activity from outside your normal borders. Obviously, everybody then is going to need some public or quasi-public functions like utilities and infrastructure like streets and police and fire protection. And then, as I mentioned before, community planning, parks, recreation, kind of the quality of life stuff that makes you an attractive place for people to come live and spend their lives and hopefully become the aging population that's entrenched in your community. So the next thing then, once I move on from this, is we think about what are the specific tools, because this is the area I come from, and what are the specific legal tools that the state, frankly, has given you to try to make these things happen. I think of it as there being a development cycle, and it's kind of a chicken and the egg thing. I think you could reasonably start from any one of these areas to try to, grow your community. But most often, the kind of things that I deal with are targeted at the top one, jobs in the industry. And so quickly, and I'll try not to get into the weeds on it, I just want to summarize some of those options that you do actually have to try to attract those kinds of jobs in industry, which will then hopefully create commerce and shops and jobs of that nature, and then leads to greater public services available as the tax base increases, the amenity things that we all need, and then it becomes hopefully a growing cycle rather than a declining cycle. We all know that. Here's these are the most commonly used tools in the state. The first being constitutional tax abatements. You have the ability as a community for three specific types of areas. One is research facilities, research and development. One is manufacturing, and one is interstate warehousing. So warehousing that touches interstate commerce. You have the ability to create a program of constitutional tax abatements where you can abate those facilities' taxes for up to 10 years. You can't do it for somebody who's been there already. You can't have your friend who already has a manufacturing facility come and say, hey, can I get 10 years of no property taxes? This benefit can only be what we call a but-for. But for granting this exemption, we wouldn't be able to do a new project. Okay, so the idea is you're not taking anything off the tax rolls. This is in order to get something new. So if someone approaches a city, for example, and I'll probably use city a lot, and of course most of that applies to counties as well, but somebody approaches the city and says, I would love to build this manufacturing facility, and it would create however 50, 100 jobs. But the economics don't work out quite well enough. We'd really like to get a tax break. This is the kind of thing that you have available to say, well, if you meet these qualifications, we could possibly give you that constitutional tax abatement. And then there's some of the process requirements, which is public hearings and notices, and just like any tax abatement, it would have to go to the Court of Tax Appeals for approval. Generally, they approve anything that meets the statutory requirements. We'll skip benefits to get through it. The second thing I want to talk about, and this is really one of the most powerful things that you have at your disposal, is industrial revenue bonds. We get a lot of feedback that they seem very complicated and maybe kind of scary, but they're used all the time. And this is really, there's so many benefits, tax benefits associated with these kinds of revenue bonds that they're very attractive when they can be used. Going through real quick, get the benefits. Okay. You can get that same 10-year property tax abatement. Any sales tax on construction materials for a new project don't have to be paid. Depending on whether you are, there are certain circumstances anyway for perhaps manufacturing that qualifies, nonprofit projects like hospitals that are 501c3s. Those kind of projects would have the ability to be issued tax exempt, federally tax exempt, which means it translates into a much lower interest rate, about 30% lower interest rate, which saves a lot of borrowing costs for people. There are a lot of tax credits available, as Professor Miller was talking about some of the earlier federal and state tax credits, and those can be used in conjunction with industrial revenue bonds. You don't have any mortgage registration tax, which can sometimes be a large cost associated with traditional financing methods, where you have a bank that that is going to file a mortgage. And then the last one is just, this is for private improvements. This is, you know, for public infrastructure, but it's for new improvements that will come and create industry in your community. Another tool that is relatively new and has only been used in a few places, the Community Improvement District. I'll talk about TIFs in a little bit, but this is very similar to a tax increment finance, but instead of capturing a tax increment to pay for public infrastructure like streets, this is capturing a tax increment. You can also create a sales tax that applies only within that district, but that money will go to the private improvement. The developer will be able to use that money for some private improvements on that land. You've got the Neighborhood Revitalization Act, which I know a lot of communities use. You identify an area, and then as new projects come on, when you create the neighborhood revitalization area, the property taxes in that year get frozen. And then any new development on that property, the increase in the property taxes that occur from that new development, the owner can then apply to get that rebated to them. And so it's a way, again, of getting a tax increment from new development incented and back into the hands of the developer to then hopefully reinvest in that same development. There is a very frankly complex and extremely seldom used, but I wanted to talk about it because it applies specifically to rural communities. Statutory structure for creating a downtown redevelopment, and as you can see, it has kind of more qualifications than most of our incentive policies do, or incentives do. And one of the reasons why it's not used very often, aside from all these qualifications and needing the approval of the Department of Commerce, is it pretty much gives you the same thing as neighborhood revitalization. I mean, the benefit is actually a decreasing tax increment rebate. So there's not a whole lot of incentive to go through all this rigmarole, but it's specific to rural, which kind of highlights some of the difficulty that rural communities have, which is there's not a good incentive program that is just for rural areas. These same programs are available to the big cities just as well as they are rural areas. And in a little bit, I'll talk about how you might be able to gain a kind of competitive advantage where you might not normally have one, but basically they're available everywhere. As far as public improvements go, the most commonly used tools for getting public improvements going, which is, of course, streets and stormwater and sewer, the things that are necessary to spur development that the developers are going to need, whether it's for housing or industry. Special assessments, I'm sure most communities, at least around where I practice, use special assessments, which is the method where the costs of building all those things are levied solely upon the property benefiting from those things. And it's a way of keeping the community at large from paying for improvements that are only benefiting one specific geographical location. Tax increment financing, like I mentioned before, this is a method, again, for public infrastructure improvements, but it takes the burden off, the tax burden off the developer, where the developer would be paying the special assessments to pay for those improvements. This is a method by which you can capture the tax increment as the property taxes go up to pay for those improvements instead. Again, a lot of developers like this because they, anything they can do not to have to pay for stuff. And transportation development district financing, you know, these are very similar where you create transportation districts for various finance structures. The odd or the slightly different thing about these districts is the governance of them is actually turned over to the landowners. You create a sort of board for this transportation district, but the statute specifically says that the initial members are the petitioning landowners who asked you to create it. And so that sort of gives away a little bit of the cities or counties' control over that area, but does have some, you know, ability to levy sales tax and pay for some of those public infrastructure improvements. And then, of course, there are various cash programs that you can institute. What I really wanted to get to before we were done was conflicts. So how do these things, which I think a lot of communities use, how do they interact with each other? Sometimes they don't interact with each other very well. Conflicts with other taxing districts. Most of the time, if you're going to rebate taxes or you're going to abate taxes, that's going to apply to all the taxing districts within that area. So, for example, if you do an industrial revenue bond, not only are the city's taxes going to be abated, but the taxes that the county has levied and the school district has levied and any other special taxing districts. And so they will often have opinions as to whether you ought to be abating taxes or whether you ought to be diverting their, you know, in the example of a TIF district, whether you ought to be diverting what would be tax revenue for them to pay for, you know, streets that they see the city as should be responsible for paying for. So those are some conflicts that come up, and depending on what you're using, you normally have to send a notice. Sometimes they have some veto power, but it varies. Neighborhood revitalization, for example, would require actual participation by all the taxing districts in order to rebate everyone. Conflicts with other tools. So if you have a tool that rebates taxes and a tool that abates taxes, that doesn't mesh. You're not going to be able to create a TIF district and then issue industrial revenue bonds to build a project within it. Because once you try to put an IRB in there, all of a sudden that tax increment that you were supposed to hold for public improvements goes away. And so those are a lot of things you have to think about ahead of time when you're doing these things and planning what you might be interested, what kind of incentives you might be interested in giving before you start down that road. Finally, you know, you get a lot of conflicts. There has been a trend lately, and I don't want to get into a political discussion at all, but there's been a trend where there's been more of a sort of grassroots anti-incentives view. And that's okay. I mean, political discourse is absolutely all right. I think, you know, there are some ways that we'll talk about how I think you can alleviate that, and let's just go ahead and get to it. The first is, you probably want to have a policy if you're going to use incentives, just to talk about the fact that these are available and when you might use them. You know, particularly in the public objections, what I find more often than not is there's a lot of concern just about only giving incentives to the certain connected people. You know, you want to be sure that you're giving the impression that, not the, I mean, this is true, but you want to give the impression, because it's true, that your incentives are available to everybody. Okay? Sometimes incentives are available to everybody, but only the politically connected people know to ask for them. So then what I was trying to get at was an impression is created that's not necessarily true. And so some of the other things you might consider are, in a policy, you can put a lot of conditions on whether you're going to give an incentive. So you have to create so many jobs, or your cost-benefit analysis has to show a certain ratio of, that it's gonna create more money, more tax base, and generate more income for the community than you're giving up by the abatement, for example. You can target lots of specific areas, and those are all good things that you should talk about within your community, you should talk about within your governing body, and really just put together a policy that says this is how you access the incentives that we're able to give, and this is our philosophy behind it. And then everybody knows that it's available to anybody who can tick off 1, 2, and 3. The last thing that I want to mention, because we're out of time, is 2 things. You can then tie those incentives to actually meeting those requirements. If you put them in your policy, a lot of communities will issue incentives and then forget all about it. It is possible, there are ways of structuring these incentives so that you only give certain percent abatement, you don't give 100% tax abatement, and you only give it for 3 to 5 years versus 10 years, and you can condition future continuation of that on the company reporting back to you on how many people they've actually hired and how much they've actually invested. And there's a lot of benefit to that, following up to make sure that what you're investing through incentives is actually paying off for you. And then the last thing I want to say is the opposite side of that is the big communities like Wichita, Kansas City, they have those policies, and they're pretty strict about it. If you don't have a cost-benefit analysis showing 1.3 return on investment, you're not going to get an industrial revenue bond. And they're very strict about those kinds of things. The smaller communities have the competitive advantage if they want to be more flexible with those requirements. So while you may want to talk about having those requirements, remember that you may have a competitive edge for somebody to come out to your community if you're not as hard on them with the requirements for incentives that, say, the big areas would be, because they're not as hungry for that development and that income. I'm sure that I had lots of other thoughts that I've skipped out on, but we've run out of time, and so I don't want to take any longer. But if anybody has any questions, of course, I'll be here on the end. Thank you.
Well, we do have 15 minutes left for questions and answers, so everybody went a little bit over, but not too much over. So I was able to keep my gun holstered. And so it's my task to be the question fielder. And so I'll just ask for something. I see one. So
Yeah.
please indicate if you have a particular member of the panel you want to ask.
Well, I think my question is probably more geared towards Ms. Clark. My colleague and I are from Southwest Kansas, and the aquifer situation in water is a big deal. It's critical. It's drying up.
Make or break it.
Exactly. And it's not just a Kansas problem. Oklahoma Panhandle, Texas Panhandle, perhaps Nebraska, the same thing. So I guess my question is, from the USDA or the federal level, if the water dries up, it's going to have a ripple effect.
Absolutely.
Is the federal government, are they viewing it as just a state problem because the state owns the water? Is it state problems, or what's their view and what's being done at that level?
First of all, water is a hugely complex issue because each state manages it differently. And so many states are part of the overall aquifer. Colorado's laws in terms of managing their groundwater, Oklahoma's laws, Texas' laws, our laws, Nebraska's laws are quite different. And I will share it. My opinion is Kansas has always had some of the most conscientious water management laws on the books of all of those states. Still in Texas today, it's fairly available. If there's water there, you can put down the well and you can start sucking from it. And yet, we as Kansas, as you point out, pay a penalty to some degree for the water use to the south of us, to the west of us, and to the north of us. So this is a really, really complex issue. It is going to take a concerted effort at the federal level, the state level, and the local level to figure out the future of Southwest Kansas and what its economy is going to be based on and what its economy is not going to be based on. And I think the answer is going to be found in a number of different ways. That's going to be technology, no offense to our previous speaker from the Land Institute. But I think technology is going to make a difference. I think different kinds of water management, different priorities, different cropping rotations and utilizations, more efficient utilization. But what it comes down to is cost of the water, the price of the water, the value of the water as it pertains to today's use of it and future uses of it. And when I think of that aqueduct project, again, I'm not saying right or wrong, but when they first came out with that study, that was a $4 billion project, and that was in the mid-'80s. I would guess that we will be looking at 4 to 5 times that price tag when you take into account the rights of way that you are going to have to acquire, the construction costs, a compact that will have to be drawn for the use of the water in the Missouri River, the construction of a receptacle and reservoirs, and the maintenance and operation of it, because essentially you are pumping water uphill all the way. Even though on map it looks like you're going this way, your elevations increase as you go toward western Kansas, so you're going to have to pump it. There's going to be a cost. But on top of that, the study is only going to look at the construction and rights of way acquisition of that particular project. Once you get it to the reservoir, how do you get it to its ultimate use? So there's an added cost. And with those costs come a value and a price of who is going to pay for that. And who is going to be the first user of it? Is it going to be the municipalities? Is it going to be the commercial and industrial interests? Or is it going to be agricultural and irrigation interests? Or how are they all going to be using that water? And all I'm saying is this is really complex, and it takes a heck of a lot of informed leadership to make the best possible future decisions. And it takes an awful lot of deep and relevant and informed discussion at all levels of government that can't be divisive and can't be polarized if you're going to get to a good Kansas decision. Kansas historically has been built on those kinds of complex issues. Free state, slave state. Doesn't get much more complex than that. We figured that one out. We can do it again. But it will be all levels. I know the federal government won't be able to stand on the sideline because it'll have to be financed by the federal government. It's water solutions. We're financing the water solutions now as USDA will develop and finance the water quality treatment projects that we're using to finance in Lincoln and over. Federal government will be a part of the solution when the solution gets ready to operate. The Army Corps of Engineers is going to have to be a big part of it as well, and that's an Army federal government partnership.
Any other questions? Yes.
This is for Andrew. Are there incentives for business retention that communities can engage in, similar to those for bringing businesses in?
Not very good ones. Well, to be honest, the whole idea behind, particularly, tax abatements, which is kind of the biggest one that everybody's interested in, requires a new project to be built, and so there's not it's a concern into that, particularly in situations where you have a facility that wants to expand, and maybe they aren't going to include many, if any, new jobs in that expansion, but it's, obviously it's necessary for their business. That's an opportunity where you can kind of use business retention as an excuse for some tax incentives for that expansion. That's kind of the only situation where we really get to do that.
Any other questions?
This is for Andrew. What is a star bond? Does that fit in those categories?
Sure. Star bond is kind of an expanded TIF district, but only for really specific things, and this is why I didn't really get into it. And you're gonna be testing me on my recollection, but the requirement for a star bond is that it be used for like a major tourist attraction. So, for example, of course, the test case was the racetrack out in Kansas City. It's got to be sort of a major draw attraction. And then, once you get past that, there are all kinds of sources of money that can be taken from that district, like tax increment, just like TIF, but then STAR, because it's the acronym for sales tax and revenue. You can create some additional sales taxes in that area, and there are some various levels of incentive money that then becomes available for those kinds of projects. And then you still have to get the approval of the Department of Commerce.
Does the lodging tax go to that?
Sorry?
The lodging taxes and things like
Yeah,
that?
right, that's one of those additional sources. If you put a hotel in that area, you can capture the transient guest tax, yeah. Yes?
I would just like to make a comment that I appreciated the candor of our speakers today and not sugarcoating the daunting issues that Kansas is facing. And to offer, I'm one of the kids that left and came home 6 years ago to Kansas and want to see us succeed and be strong. And, because I'm no longer a kid, so that was the old days. But I want to offer up maybe 2 other solutions for all of you to think about in your communities. One is your local community foundation. Private donors are there to support the future of Kansas, and keep an eye out for the Keep 5 in Kansas campaign. It truly will be a salvation for Kansas. And Patty opened the door for Public Square Communities. I am a colleague with Public Squares, and it is also just, whether it's with our system or just in your local community, hearing from your local citizens. We've got to band together and hear the local voice. So all the issues brought up today, I really appreciate hearing from all of our speakers.
And I want to add one more thought, if I may. And this is across the board. This is not rural, or this is not rural versus urban or rural or urban. Communities have to begin to understand that everything they do, every decision they make is economic development. What you invest in your education is economic development, both in facilities and quality of the curriculum and teachers and how you value education. What your community looks like in terms of its housing stock. Is it blighted? Is it dilapidated? Is it in good shape? Does your housing availability match with the people that are seeking houses? What condition is your infrastructure in? Are you sitting on a 100-year-old water system that leaks all the time? Are you going to make an investment in an improvement, whether in the water system? What's your Main Street look like? All of those things. What's your parks and recreation program? What's your cultural events? What's your investment in your libraries? Each and every one of those public expenditures is economic development, and it makes your community attractive and a desired place to live by the next generation. So that's how we've got to start framing this notion of economic development. It is not just jobs